Hi everyone, this is Oiza. For this edition of speaking with the managers of facilities, of healthcare facilities, I have a rare privilege of speaking to the medical director of Next Haematology Medicare Center at Surulere. It's a different conversation because of the nature of the facility, and I'm very sure that you're going to enjoy it. Right with me here, I have Dr. Popoola. I'm just going to hand over the mic to her to introduce herself and talk briefly about what she does. Hello, Dr. Popoola.
Hi. Thank you. Good morning. My name is Dr. Folasade Popoola. I'm a consultant clinical hematologist and the founder and medical director of Next Haematology Medicare, where we are at the moment. Basically, we are a specialist center that focuses on blood disorders. So whether it be malignant or non-malignant, to make it simpler, so whether it be cancerous or non-cancerous blood disorders, that's what our specialty is. And the most common non-cancerous disorder in Nigeria is sickle cell disease. We have the highest population of sickle cell patients in the world, hence the need for specialist services for them. So things like the automated red cell exchange transfusion is something that we do. I think so far, like I was just saying, we're 4 years old now, and we've probably done about 600, 700 procedures so far. So it's been great. Of course, we have quite a lot of patients that come back. So it's been an awesome experience so far. In addition to that, because it's the apheresis machine we use for this, so we also use it for things like platelet collection from a single donor. So those are apheresis platelets. We also use it for things like plasma exchange. So plasma exchange or plasmapheresis is very, very essential in patients with autoimmune diseases, especially when they have flares or when they have emergencies. So many times you have to take out the diseased plasma and replace with healthy plasma. In the same vein, we can harvest stem cells with the same machine. And the endpoint, or our future goal, is to be able to start our stem cell transplants and bone marrow transplants within Next Haematology Medicare. So yeah, that's what we are.
Okay. So this is just to inform that this is our very first hematology specialist facility that we've come to, and from the brief conversation we've had already, there's a wide range of services that go on here that are, like she mentioned, specialists and tailored to a group of people. So the services that they render here are niche and essential. So I'm just going to ask now, you've had this facility for 4 years. What are some of the challenges that you faced then and now running your business in this environment and time?
Thank you. I think I'd say first of all would be getting it right in terms of structure and personnel.
Okay.
Of course, structure, you have to get your wiring, your plumbing, the little things, they're very important. For instance, we just had to replace our borehole last year. Even though we just did a new one when we were starting, they failed, but you cannot do without good water. Same thing, just as those are essential, it's the same way human personnel are extremely essential. So of course we've had quite a lot of back and forth in the initial year or two, but we're now stable in terms of staff. I'll say I have a good set of people who understand the vision and mission. And once you have people who you can work together, who you can actually form a team with, of course, just like the tongue and the teeth would, have friction.
Yeah.
We have friction, but we easily resolve it because we understand the end goal, which is what we want the patient to be happy. What I always tell them is that patients are not here for a visit or on holiday. They're not well.
It's something that I say often.
They're not well, so you can't now, with your own attitude, make them even feel worse. No, you have to give them hope, you have to give them joy, you have to let them see, oh, there's still some light at the end of the tunnel. And that for me was the main essence of setting this place up. So, after my residency and I became a consultant, even before actually, I knew I wouldn't travel out to stay, and I also knew I wouldn't work in a government institution. The government institutions are, for instance, for my residency program, fantastic. But in terms of little things like these,
the extra care,
it's a little more
comfort,
difficult. Yes, even getting this machine, for instance, to be, working 24/7 as it should. It's always a problem when there is a lot of bureaucracy. So sometimes it's best to just start on your own if you can, and then take it from there organically. And for me, I've had no regrets. Of course, maybe because I'm the kind of person that I'm a go-getter. If I need to do something, I do it. I don't look for the excuses. Oh, what's the problem? The question I will ask is, what's the solution to that problem? Once you can find a solution to the problem, then we're good to go. So it's been, the staff have been great now. We're good, and I think we're all happy, so we celebrate each other. They know I'm there for them, just the same way I would, make sure that they don't mess up on their work. Because the way we are, we need a very good medical team. So of course the nurses, I work with other doctors. So for instance, when we have to set central lines for our patients for red cell exchange, or even if I'm not around and I need somebody to come in to quickly see a patient, I have fantastic colleagues that come in and they just come in and see the patients, and so it makes work a little easier for me as well. Of course, the lab staff is extremely essential. So that's where, for instance, our full blood count quota machine comes in, which we got from Ikons, right? And we got the first one in 3 parts initially. Then we changed to a 5-part like 2 years later, because I needed the other parameters.
Yeah.
And that has really helped. And of course, for every procedure, for every patient, cancer patients, sickle cell patients, before exchange, post-exchange, post-transfusions, whatever it is, you always need the machine to run.
Yeah.
And it's so easy to use that even the nurses use it. So even if the lab staff are closed and I still need to do something, maybe an emergency comes in, anybody can put it on, run it, and run we get our results. Yeah. So it's extremely essential. Before every clinic, every patient has to have their full blood counts done. So easily we do that, somebody comes from somewhere else with a referral with some results, and I want to know what's going on at the moment. Immediately, within 5 minutes, you have results. So it's so essential, and so we've had great use of the machine. Of course, in addition to our housekeeping and the security, everybody works together. So far, so good.
Right. So without being biased, so this has been one of my favorite conversations so far. One, because it's a separate angle from what we're doing, and now we're talking with managers. And two, because of the insight into some of this is the goal actually, to see things from the perspective of the managers and to see how business is running, and how things go in this. And because this is the specialist center, the knowledge is priceless. Just to mention that Next Haematology Medicare is situated in Surulere. So if you're having any of those needs, you know where to come to. I don't have to ask further questions because she's already answered the working relationship with Ikons. If you have any your current challenges, in this, the economy and things, in terms of patient care, whether the number has gone up, or you've had your patients not being able to continue some of their care, what's that been like?
All right, thank you. So I'd say it's a mixed picture. Mm-hmm. The economy, of course, has affected everyone, not in the best of ways. Well, because things have become quite expensive. So even our procedures on the machine, the prices have gone up because all the consumables have gone up. However, because of how essential the services are, somehow people still need these things. And so we still get our patients, and for me it's extremely essential that they get what they need. So there are times when, okay, we can't pay up front, it's not a problem, pay bit by bit. I don't have a problem with that, as long as it's something I can work with. It's not a problem. I think it's important not to focus on the money. While money is essential to run a business, if you don't focus on the money, you'll be shocked how much more returns you get. Because when anybody sees that what you are focused on is them getting better, they'll find a way.
Yeah.
And I always encourage them to join the insurance, the health insurance, because AXA Mansard, Total Health Trust, and a few others, well, maybe not many, maybe just 2 or 3, but they have been able to cover care for sickle cell patients, for some cancer patients as well. Of course, family social support is extremely essential. So many people, of course, rely on that. When it comes to medication and stuff, everything really, the prices have really gone up. But somehow people are still able to get the care they need. And so I wouldn't say patients are paying bills. No, not really, because it depends on how you're looking at it.
Yeah.
If you're looking at just profits, then maybe. But if you're looking at how patients have been able to get care, I think we've been able to adjust in a way that people still get the care they need.
Okay.
So, for instance, if they're on the insurance, they know that they just need to pay that one-off premium, and for a year
they can get their care.
Yes. So somehow I think that has really helped. It has really, because if they were paying out of pocket, it would be much more difficult. Yes.
Okay. Dr. Popoola, thank you so very much
You're
for your
most
time.
welcome.
I've enjoyed this. Thank you. Thanks very much.